for the first talk, I would like to invite Dr. Nikita, and she is going to speak on AI innovations in OCTA, a game changer for ophthalmic imaging. Dr. Nikita is Dr. Nikita is an RPC element. Rajendra Prasad Eye Center is one of the most prestigious eye center of this country. She has completed her MCH in vitreoretina from another exemplary institute, which is PGI Chandigarh. Over to you, Dr. Nikita.
Thank you, sir, for the kind introduction. Good morning, everyone. At the outset, I would like to thank the organizers and Dr. Ankur, sir, for giving me this opportunity. I'll be talking about AI innovations in OCT angiography, which is actually a game changer for ophthalmic imaging. We all know that OCT angiography has revolutionized retinal imaging by providing high-resolution, non-invasive visualization of the retinal and choroidal vasculature. Now, with the integration of artificial intelligence, especially machine learning and deep learning, it's undergoing a transformative leap in diagnostic and analytical capabilities. Let's briefly look at what is machine learning. It's a branch of AI that enables systems to learn from data and improve over time without explicit programming. Its applications in OCT angio include automated segmentation of retinal layers, disease classification, predicting disease progression, enhancing image quality, and quantifying vessel density. Deep learning, however, is a subset of machine learning that uses neural networks with multiple layers, as the name suggests, deep learning, to model complex relationships in data. It can analyze OCT angioscans at a deeper level and identify subtle patterns which are beyond human capability, which include precise vessel segmentation, detection of capillary dropout or neovascularization, image denoising and reconstruction, multimodal image integration, anomaly detection, and predictive modeling. So machine learning works well with less data, requires manual feature selection, has simple algorithms, less computationally intensive, and easier to interpret. However, deep learning requires larger data sets, learns features automatically, involves complex neural networks, requires computation, and is often difficult to interpret. Let's look at the applications of AI in OCT angiography one by one. Now, signal generation is one of the most important tools to generate good OCT images, and we know that it requires multiple B scans to measure motion contrast and extract flow signal. However, learning algorithms can be taught to create OCT-like angiograms directly from maybe a single OCT scan. This transforms the OCTA signal generation from a motion contrast measurement to an image translation problem, which is a well-studied branch of machine learning. So this is an OCT angiography signal generated from a Zeiss angioplex machine, and this is an OCT angiogram generated from a deep learning algorithm using just a single B frame, which is almost similar to what a normal OCT angioscan looks like. So it not only requires shorter OCT angioscan acquisition times, but also induces less motion artifacts. And it can also recover information from currently available clinical OCT scans in which octa scan pattern was not applied, potentially increasing the amount of data available for OCT angiography quantification and development. However, sometimes this extracting information from just a single B scan can be challenging, and it has been shown that sometimes AI fails to capture some capillary details which can be obtained from OCT angio. Coming to the next application in OCT angiography reconstruction and enhancement. Rather than generating OCT angiography data from the starts, convolutional neural networks can be applied directly to the already available scans to improve image quality. So one of the major limitations of contemporary OCTA scans is that for a larger field of view, the peripheral data has low image quality. However, this is a reconstructed OCT angio scan from the original scan using deep learning algorithm, and we see the peripheral scan quality is also enhanced, and there is no loss of image quality even in the periphery. So image reconstruction networks offer the potential to improve OCTA angio image quality without inducing any data acquisition problems. Next is retinal slab segmentation. It is a final piece essential to generate on-fast OCT angiograms of each capillary plexus. Now, how do these retinal slab segmentation algorithms work? They usually work by identifying features in the axial reflectance profile and correlating them with anatomic features. However, these are vulnerable to changes in magnitude due to speckle variation, any pathology like retinal fluid drusen, or low image contrast. And therefore, they are not specially robust. Semi-automated procedures can also be done to improve performance, but they're potentially labor-intensive. So with deep learning, models can be optimized to accurately segment retinal slabs for eyes with a specific disease. So this is a retinal slab, peripapillary retinal slab segmentation done using a convolutional neural network. This is through the peripapillary, through the red line, and this is through the blue line, that is through the optic nerve head. And we can see all the layers segmented from the ILM to the RP Brooks complex. Next, most important is artifact removal. AI can also be used to identify and remove specific artifacts. Let's first see the bulk motion artifacts. We know that these manifest as extremely disruptive bright stripes, although they can often be removed through hardware approaches or registration of different priority scans, but their information will still be missing from those scans which are lost to the microcircuits. So instead of replacing these missing frames, the convolutional neural networks utilized in deep learning generate angiographic data for even the microcircuit affected B scans. Any bulk scan due to slower forms of motion like ocular pulsation and drift can also be corrected with these AI algorithms. So this is a original OCT angioscan, and we can see the background is not very clear, and this is the normal OCT angiogram, and this is a regression-based bulk motion subtraction algorithm used OCT angioscan generated through deep learning, and we can see there is much better contrast between the vasculature and the surrounding tissue. Shadow artifacts, as we know, are especially problematic, especially since in severe, they cause signal attenuation, and best is to detect these artifact-affected regions in order to exclude them from quantification, because they can erroneously detect non-perfusion areas. Now, shadowing artifacts indiscriminately darken both the structural OCT as well as the OCT angiography signal, and this simultaneous occurrence can be used by intelligent algorithms. The random forest is one of the deep learning technique which is capable of accurately segmenting shadow affected regions. So this is, you see the OCT angiogram detected through the deep learning, which has detected this shadow artifact which is being created through because of the vitreous floater in both this patient of uveitis as well as in this patient of diabetic retinopathy, so that this is not erroneously detected as a non-perfusion area. AI can also help in analyzing a lot of OCT angiographic features like vessel density and segmentation. It's a valuable metric which correlates with disease severity, especially in eyes with DR and glaucoma. And it's usually a segmentation task, and CNN algorithms have been shown to perform comparable to manual segmentation. So this is a CNN generated output, which is segmented the vessels using a deep learning model. The differentiating arteries and veins. This has also been shown to be done by CNN algorithms with more than 80% accuracy. So to generate these differentiate between arteries and veins, they register the on-fast OCT images with the color fundus photos and also use the structural OCT information and can help differentiate arteries and veins, because otherwise manually doing this is a very difficult task, because it's not possible to differentiate using the flow signals alone. Non-perfusion areas, we all know that they are very important to identify in certain vascular pathologies, and they are very similar to shadowing artifacts. Though they are superficially similar, intelligent combinations of structural OCT and OCT angio data can distinguish these non-perfusion areas and shadowing artifacts. So the deep learning algorithms can again identify these with a more than 95% accuracy, and they're resistant to any image quality artifacts. So this is a non-perfusion area. We can see all these non-perfusion areas has been differentiated by the CNN network from any shadowing artifacts. The yellow ones are the shadowing artifacts and the blue ones are the actual non-perfusion areas, which has been done by a deep learning algorithm. So choroidal neovascular networks are also very important to identify, and projection artifacts, we all know, appear very similar to these choroidal neovascular networks since they retain the vascular characteristics of the vessels that generate them. They can also appear on top of the real CNVs, detrimentally influencing any related quantifications. So deep learning algorithms can perform robustly despite these similar complications with an accuracy of more than 95%. So this is a deep CNVM detection using a deep learning algorithm. They take a raw inner retinal angiogram and a projection resolved outer retinal angiogram and a volumetric structural data from the outer retina as input, and then they generate a CNVM membrane, and then further segmentation can delineate the CNVM vessels alone. Retinal fluid also is more readily identified in structural OCT scans. However, they still have a signature in the OCT angio channel since vessels do not occur in fluid regions. The deep learning algorithms can again identify the retinal fluid. So this is a retinal fluid generated through the deep learning algorithm pre-treatment, and this is post-treatment, and then they can show that where the pre-treatment fluid was there and now where the post-treatment fluid is remaining. So we better know how much fluid has actually resolved even on the OCT angio scans. So AI in OCT angio improves not only efficiency, but also accuracy. Obviously, it reduces human error, improves diagnostic precision. It improves consistency by uniform grading of scans, increases scalability by handling large volumes of data in real time, and it can early detect a lot of pathologies. However, there are certain challenges and considerations that come with AI, which is of course data privacy, bias in training data, interpretability, making AI decisions understandable to clinicians, integration of AI tools with clinical workflows, regulatory handles, and clinician training. So to conclude, AI innovations in OCT angio represent a paradigm shift in ophthalmic imaging, and by leveraging the power of machine and deep learning, clinicians can unlock deeper insights, enabling proactive and personalized patient management. It not only enhances diagnostic speed, accuracy, but also accessibility. It's poised to be essential in future ophthalmic care. So the fusion of AI with OCTA promises a new era of precision diagnostics, early detection, and individualized patient care. What the future might look at real-time diagnosis, predictive analytics, teleophthalmology, and maybe AI-driven research. These are my references. Thank you, everyone.
Thank you, Dr. Nikita. Any questions by anyone?
Thank you, Nikita, for a very wonderful insights into how OCTA is being driven by AI now. And I think we already have some amount of, algorithms which as of now fill in data, because we have data gaps when we acquire these scans through various machines. So all commercially available machines do use some kind of algorithms to fill in these kind of data. So one thing I would like to ask you is, are there any projects or going on whereby AI based on OCTA would help us in predicting the future of a human being in terms of developing future diseases, maybe neurovascular disorders like Parkinson's or Alzheimer's?
So I'm sure they may, but I'm not really aware of.
Sir, there has been a study going on recently. Initially, it was a pilot study to compare the vessel diameter and to look at the vessel diameter from the OCT angiography and compare it with neurodegenerative diseases. So they have found a significant correlation in a way that the vessel density, when it decreases, they have seen that these are the patients who are predisposed to Alzheimer's as well as stroke. So this Alzheimer's is a one different study, and stroke one is the second one study. So building upon these AI algorithm, what like the Google did it for diabetic retinopathy. What they are trying to do is that they are trying to have a positive predictive value for a disease, and it's just the future that is gonna unravel is that a one machine which has an fundus camera, OCT angiography, OCT inbuilt into it, is going to diagnose you without the need of a human over there. The same data is going to be shared to the registered retina practitioner who is going to be in the same city or different city, and you will be booked with that. So that's how the paradigm is changing.
I think that's very important, because what is going to happen is probably we will be able to predict the various diseases which a person is predisposed to. And that will be a very useful insight as to which person is predisposed or not in a very non-invasive way. Yeah. So that is one important thing. And as of now, we are all aware that there are many AI algorithms which are available. You can call the next one. And what happens is that there has been none, actually, if you see, everybody is developing AI algorithms, but which has been used commercially. So people have been developing, individual people have been developing, but I don't think they have been put to use, because no one is ready to buy them, who is ready to invest in AI technology to be used in clinical practice. I think that is something which remains a challenge as of now.
Yes.